The following is a brief presentation that may help you understand your impairment rating for the Energy Employee Occupational Illness Compensation Program Act, Part E. If you have a card like this, you have been accepted into the Part E of the EEOICPA program through the Department of Labor. There are two parts: treatment of accepted medical illnesses by a physician of your choice, and compensation based on a whole person impairment rating of accepted medical illnesses using the AMA Guides 5th edition. The impairment rating can be repeated every 24 months. Impairment rating, a translation of complex medical conditions by a trained physician into a number-based percent of a whole person for use by non-medical administrative personnel for determination of disability and compensation. It is not intended for use in medical treatment or prognosis of medical conditions, but to calculate compensation. Physicians qualified to perform impairment ratings under this program must be a diplomat of the American Academy of Disability Evaluating Physicians or diplomat of the American Board of Independent Medical Examiners. This may be why your treating physician or primary care provider was unable to perform your impairment rating. The American Medical Association Guides to the Evaluation of Permanent Impairment 5th edition. This was printed in 2000 and is the edition used. There is a 6th edition printed in 2007, but for the EEOICPA program, the 5th edition is used. Impairment rating process, the examiner's role. This is not a traditional doctor-patient relationship. No treatment or treatment recommendations are provided. The process is administrative and intended to meet the requirements of the EEOICPA Part E program. The report is not final until the DOL approves. The examining doctor is responsible to notify you or your treating physician of newly discovered serious abnormalities or findings. Impairment, the loss of use or derangement of any body part, organ system, or organ function. Disability, alteration of an individual's capacity to meet personal, social, or occupational demands or statutory or regulatory requirements because of an impairment. Disability is a relational outcome contingent on the environmental conditions in which activities are performed. Maximal medical improvement. This is a requirement for an impairment to be calculated by the AMA Guides. It is a condition or state that is well stabilized and unlikely to change substantially in the next year with or without medical treatment. Over time, there may be some change. However, further recovery or deterioration is not anticipated. In brief, if a condition requires treatment for correction, do that treatment and then do the impairment rating. The AMA Guides look at an impairment as being that of a whole person. A 100% whole person is composed of organ systems which are addressed individually by the AMA Guides. For example, if there is an impairment of the respiratory system of 20%, then 20% is taken away from a 100% whole person, resulting in a 20% whole person impairment. Impairment versus disability. Impairment is a loss of a body part or body function. For example, the loss of a finger at the knuckle under the AMA Guides 5th edition is a 5% whole person impairment, 5% of a 100% whole person. Let us compare impairment versus disability. In the first case, a lawyer may have a 5% whole person impairment due to the loss of a digit at the knuckle and may have no disability. In the second case, a violinist with the same loss of a finger at the knuckle, would have the same 5% whole person impairment. But due to their work, their inability to play their musical instrument, they may have up to a 100% disability. Impairment is the same in both, 5% whole person impairment. It is this, the whole person impairment, that the physician will calculate. Disability, which is an economic measure, will be determined by the Department of Labor. Again, looking at impairment versus disability, this can be confusing. Let us look at a 5% whole person impairment, which may result in a disability. For a person that works for Federal Express or the U.S. Postal Service, it may have a certain disability based on their job requirements. For the Department of Labor, under the EEOICPA program, this same 5% whole person impairment may have a very different disability. We are in the DOL EEOICPA system. Impairment for organ systems. Multiple illnesses may exist in the same organ system, such as asthma, asbestosis, and COPD. The AMA guides instruct that a whole person impairment for each illness in the same organ system is calculated, and that the highest of the three is used to represent the whole person impairment for that particular organ system. Another example is skin cancer. There may be multiple separate lesions, but a single whole person impairment is used to cover all the lesions of the skin organ system. The more advanced the condition, the location and number of lesions will determine the single whole person impairment. Impairment for multiple illnesses. Each accepted illness is assigned its own whole person impairment. One illness may have a 60% whole person impairment and a second a 50% whole person impairment. If you recall, the impairment rating is based on a 100% being a whole person. If we were to add these two illnesses, whole person impairment, it would total 110%, more than a whole person, and not recognized by the AMA guides. Rather, the guides provides a formula to combine the impairment ratings for each illness. In this instance, 50 is combined with 60, yielding an 80% whole person impairment. This is to prevent having an impairment of greater than 100% whole person. Follow-up impairment ratings. Prior accepted illnesses can be addressed every 24 months. Impairment rating is based on status of disease at time of rating. It is possible follow-up impairment rating will not be higher. Treatment may improve condition and decrease impairment. Impairment may be adjusted for age. Remember, impairment is not the same as disability. Today's evaluation addresses impairment using AMA Guides 5th edition. The Department of Labor has the final say in the determination of impairment rating. Until DOL accepts impairment rating determination, it is not official. The examining physician performing the impairment rating does not work for or have administrative authority in the DOL EEOICPA impairment process. Specifically, the impairment rating physician is to determine an impairment only for accepted illnesses by the Department of Labor. If the impairment rating physician provides an impairment for an illness not yet accepted, it would place the claim at risk for being denied. The Department of Labor can also modify or change the method of any of the AMA Guides methods. Process and review. Acceptance of illnesses for impairment rating by the Department of Labor. Accepted illnesses are at maximal medical improvement for the purposes in the impairment rating process. Records are reviewed. Additional tests may be ordered to ensure the most accurate impairment can be determined. Select the best method to calculate the impairment rating. If there is more than one, it is the highest that is used. Schedule appointment examination by impairment physician. Impairment rating for each accepted illness is determined and combined to have a final whole person impairment. The report is sent to the Department of Labor Claims Examiner for review, usually within 7 days. You would then receive notification, usually in the form of a letter, by the Department of Labor of acceptance of your claim with the whole person impairment, compensation. This may take several weeks to even months. I hope this presentation was helpful in increasing your understanding of the impairment rating process. Questions for further explanation can be directed to your examining physician, their staff, or your resource center. Thank you.